So what we recognize with MPN patients is that they have a range of difficult symptoms. And our therapies, even when they are effective, they may help those symptoms, but they rarely resolve them completely. With fatigue in particular being the most common unresolved symptom, but other ones can be present. So our group has been very interested in trying to see, are there non-pharmacologic, i.e. non-medicine, ways to try to improve that? Clearly we learned from our colleagues that treat breast cancer and many other diseases that a range of things can be helpful, whether it's nutrition, physical activity, meditation, stress reduction, what have you. We're studying several of these things in parallel. We presented this meeting, as well as published this month in Hematologica, the results of the first yoga study ever conducted in myelofibrosis. Indeed, it's one of the few yoga studies in any blood disease, as they've primarily been used only in patients with breast cancer or other such settings. What we showed in that study was that the ability to have a yoga intervention at home was feasible. We had an online yoga module developed specific for MPN patients, modified for them. They'd be able to do these yoga sessions at home. So we did that trial to assess, was it feasible? Did they understand the modules? Could they do them? Did they find them safe? And then evaluate, did they find it helpful? Did it help with symptoms? Did it improve fatigue, etc.? We found that both things were the case. It was feasible, folks could follow them, it was clear, they enjoyed it. We learned a bit about what they thought of the physical activity part of yoga, as well as the meditation part. We learned that it did help to improve those symptoms as well. So as next steps, we'll be presenting at EHA later next month results of the second study that fully accrued, about 70 patients with MPNs randomized to yoga versus a control group, again to both evaluate those endpoints in terms of improvement in symptoms as well as sleep. That it's clear that yoga, one of the reasons it benefits people is that they may sleep better, which is an important part, but we're also remotely measuring biomarkers of inflammation that they're able to get done at home. So we're hoping to learn from that and then have a phase 3 trial that is planned to try to, in the end, define a series of tools that MPN patients will be able to access from home with their doctor's awareness and blessing to try to help their symptoms. Is that yoga? Is that meditation? Is that a nutrition intervention? Is it some mixture therein? It may well need some degree of personalization, but I do think we can do more than just prescribe medicines to help patients.